audience in here. Do you ever wake up and have pain or stiffness in both of your knees or one of your knees? Do you change your activities based on the way you feel? Do you not leave home because you just can't go out for that day? Do you take 2 pills in the morning and hope that they help enough so that you can see your family the rest of the day? Knee pain plus elevated number of birthdays equals, you guessed it, arthritis. So, knee arthritis is narrowing of the joint space between the femur and the tibia bones. This is a model of the knee. You can see here the femur, and this is the tibia. And in between, you see the cartilage. That's the cushioning between the bones. The cartilage can be similar to, say, the tread on your tires. So as it wears down, it becomes almost gone and non-existent. And that is when you have the arthritis. Eventually, you decide to see a doctor about it, usually an orthopedic specialist. As an orthopedic nurse for 9 years, I've listened to my patients tell me every day, this is how I feel. This is what causes me to not be able to do the things I want to do. When you come to see your doctor, they'll review your medical history, your surgical history, they'll do a physical exam, and usually x-rays, and then your doctor will determine what is best for you for treatment. Today we're going to talk about the different kinds of treatment for knee arthritis. We'll get started by talking about some of the conservative methods for knee arthritis. We'll talk about conservative methods, non-surgical treatment options, and surgery. So, some conservative methods include physical therapy. According to the book Joint and Bone Health by David Ollie, physical therapy is very important because it helps to strengthen the legs. We use physical therapy to work for minimal arthritis, but it doesn't help for bone-on-bone arthritis. NSAIDs are medications that can be used for for your arthritis. It helps to reduce the inflammation. Ibuprofen and naproxen or Aleve are common ones. The other medications that can be used for arthritis are narcotics or opioid medications. Those are addictive, and the doctors try not to prescribe those, usually only after a surgical procedure. Analgesics are very helpful. Weight loss and exercise is the most strongly encouraged conservative treatment method. The weight loss, according to Bone Health and Joint Health by David Ollie, states that every excess pound exerts 4 pounds of extra pressure on the knees. Someone who is 10 pounds overweight will exert an extra 40 pounds of pressure on their knees. Imagine if you were more than 10 pounds overweight. Weight loss is the safest way to help your knee arthritis. Some non-surgical treatments for knee arthritis are usually intra-articular injections. They can be cortisone shots or something called viscosupplementation. The cortisone shots are made up of a steroid, usually Kenalog or betamethasone, and an analgesic like lidocaine, similar to what you get when you go to the dentist, like Novocaine. The viscosupplementation injections are gel shots. They're manufactured by man and injected into the joint, and they're lubricating. When all else fails, the shots don't work, the conservative treatment with physical therapy and activity modifications and weight loss don't work, then we move on to offer you surgical treatment. The surgical treatment is considered total joint replacement or arthroplasty. This is a model of total joint replacement. This is your femur and this is your tibia, and they model the bone so that the prosthetic joint can fit on the end of it, and therefore reducing the fact that you don't have cartilage present. The plastic in between the prosthetic pieces takes the place of your cartilage. You're then able to move comfortably. The Book of Orthopedic Secrets by David Brown states that the surgical procedure takes 1 to 2 hours under administration of anesthesia with IV and you are administered opioid pain medications. The medical surgery nursing textbook called Assessment and Management of Clinical Problems advises that postoperative rehabilitation for a total knee replacement can take up to 3 months. Physical therapy usually begins on the same day as the surgery. Pain management is necessary to complete your rehabilitation. If your rehabilitation is limited because the pain is too uncomfortable, you will not achieve optimal outcome. So now that you've learned about the basic treatment options for knee arthritis, I hope you feel empowered. Knowledge is key. In conclusion, we've learned about many different ways to treat arthritis, some of which you have probably already tried. Conservative methods include physical therapy, weight loss, activity modification, and medications, both prescription and over-the-counter. Non-surgical methods include intra-articular injections, cortisone shots, and viscosupplementation, or gel shots as they're commonly known by. As a last resort, people choose to have surgery, which is total joint replacement. If you determine that you want to have some sort of treatment, it usually is a consideration of when is enough enough. If you make that decision, I hope that you find the information helpful today. Thank you.